At present, we now have evidence that renal denervation can lower blood pressure effectively compared to a sham control. Just in the last year, there have been 3 sham-controlled trials that have been reported out. The first is a RADIANCE-SOLO trial. This is a trial of the RECORE Paradise system in patients who are weaned off medications. The second is the Medtronic SPYRAL Off Medicine trial, and that was the Medtronic SPYRAL device in patients who are weaned off medications. And the third is the Medtronic SPYRAL On Medicine trial, which looked at patients that were on medications and then compared denervation with that device versus a sham control. All 3 trials showed effective reductions in blood pressure relative to sham, and so unlike the position we were in a few years ago where we questioned whether renal denervation actually could lower blood pressure, where we are now in 2018 is a juncture where we know it does reduce blood pressure. The question is, in what patients is it most effective, and how much that can be spelled out in the clinical practice if we can prove this currently in larger and ongoing studies. Correct. So 2 pivotal trials for approval here in the United States are ongoing. The first is the Medtronic SPYRAL program, and the second is the RECORE RADIANCE-2 trial. Both studies are being launched or launched already, and we anticipate that if those trials succeed, that would then allow regulatory approval of these renal denervation therapies for use in the United States. We estimate that these trials should hopefully enroll in the next 2 years or so, and then report out after that time point. Now, I do want to caution folks to recognize that we need longer-term safety data of these devices, and so the patients that were in the earlier trials are still being followed for 3 years. Even in the currently ongoing pivotal trials, we'll be following patients for at least 3 years to be sure that the procedure is safe. But in terms of the efficacy endpoints, those would be realized at a sooner date.